Today I would like to talk to you about monkeypox, emerging and re-emerging disease. To give you an overview of the disease, in 1958 in Denmark, this virus of monkeypox was discovered, and in Congo, a 9-year-old child in 1970s was found to have monkeypox. And this has been ongoing in Congo till about 2005. And in 2017 in Nigeria, it has re-emerged. So it becomes very important. Mpox is an enveloped double-stranded virus. This was originally known as monkeypox virus, and it is a species of the genus Orthopoxvirus of pox virus. The natural reservoir of this virus is unknown, therefore it becomes very important to address it, and it has become a potential threat and a problem and addressed by the WHO as well. So various small mammals such as squirrels and monkeys are susceptible. There are distinct two clades of the virus, clade 1 and clade 2, which is subdivided into 1A and 1B and 2A and 2B. The vaccines for this Mpox virus is very important and is being considered, and it's as a public health intervention. Coming to the epidemiology, about 120 countries have reported Mpox between Jan 2022 to August 2024, and about a lakh of lab-confirmed cases reported. About 220 deaths have been confirmed. So it has been confirmed as a global outbreak, mainly of clade 2B in 2022, and continues to this day in some of the African countries, mainly over there. Also, outbreaks of 1A and 1B affecting the Democratic Republic of Congo and other countries in Africa have been seen. And in 2022 to 23, a global outbreak of Mpox of clade 2B strain has been discovered. In August 2024, 1B clade has been discovered in Africa. The Mpox virus, how it is transmitted is mainly through close contact with someone who has monkeypox or Mpox, and through skin to skin, by touching, mouth to mouth, mouth to skin, face to face, somebody who's close by with respiratory breathing close, so the particles are transmitted, and also multiple sexual partners. Also, it can be through clothing, linen, needle injuries, community settings as in tattoo parlors. Also, during pregnancy or birth, the virus is transmitted, so perinatal transmission is there. So it is also affecting the newborn and is resulting in loss of pregnancy, stillbirth, death of the newborn, and complications to the parent. Animal to human transmission has also been reported by bites and scratches, and in hunting expeditions, skinning, trapping, cooking, playing with carcasses, or eating animals. Thus, it becomes very, very important, and further studies are required. Coming to the symptomatology, usually it becomes pertinent or important when the symptoms appear within a week, but can start from 1 to 21 days of the exposure, and some of the symptoms are lasting up to about 2 to 4 weeks, and generally more so in a weakened immune system. The symptoms mainly can present with a rash or with fever and symptomatic like muscle aches, backache, headache, low energy, swollen lymph nodes. And coming to the rash being very important, it's painful, and it can last from 2 to 4 weeks, usually starting from the face to the palms to the sole, groin, and anal area. Usually it's a flat sore which is filled with liquid, leading to blister formation, which is itchy and painful. And as the rash heals, the lesion dry up, crust off, and fall off. So all this is part of the infective time, and transmission is possible. Sometimes it also leads to other complications like proctitis, difficulty in passing urine, dysuria, and difficulty in swallowing, dysphagia. It can also lead to a very severe condition with deterioration in symptoms and leading to things like myocarditis, loss of vision, pneumonia, vomiting, diarrhea, malnutrition, sepsis, encephalitis, and balanitis or urethritis. So these are the severe cases and lead to some deaths as well. So it is fatal. The diagnosis is very important, and a lab confirmed test with a polymerase chain reaction, the viral DNA is tested. The symptoms happen and the person gets tested. This test can be done through the rash, the skin, the fluid, the crust, and through vigorous swabbing. Usually the blood test is not recommended in this, and in cases of absence in the skin lesion, the samples or the swabs can be taken from the throat or from the anal area. The antibody detection methods are not useful as they do not distinguish between other orthopox viruses. So it has similar symptoms to the other viruses. So we need to differentiate between syphilis, herpes, varicella zoster, and the HIV testing should also be offered to most of the Mpox and in cases of children as appropriate. The groups that are mainly in higher risk are the health and the healthcare, the people working in the healthcare setup, as they have more exposure, and also in the people of the same household, community, or the children, and persons who have multiple sex partners as well, and men who have sex with men. Sex workers of any gender and their clients are important and they need to be addressed. More research is needed in people who have more of these symptoms and where there is an outbreak in different settings and in different conditions. The goal of the treatment of Mpox is to take care of the rash, manage the pain, and prevent the complications. Early and supportive care is important to manage the symptoms and avoid further problems. So supportive care such as the pain and the fever, a close attention to the nutrition, the hydration, the skin care, prevention of the secondary infection and the co-infections, and particularly of HIV and all the varicella zoster, etc. To date, there is no proven antiviral treatment for Mpox, and antiviral retroviral therapy in HIV patients is to be continued and initiated within 7 days of diagnosis of HIV. The vaccination, getting an Mpox vaccine can help prevent the infection. So there's a pre-exposure prophylaxis, and it is recommended in people with high risk of getting Mpox, particularly in outbreaks. Also, people with post-exposure prophylaxis who have been exposed to the Mpox. So less than 4 days after contact with someone who has Mpox, and the vaccine can be given up to a maximum of 14 days even if the patient has not or person has not developed symptoms. So there are some self-care and preventive things that we need to consider. The do's are: contact the healthcare provider, stay at home and in a well-ventilated room, wash your hands with soap and water, sanitize it, and avoid touching the sores. Wear the personal protective equipment like masks and cover the lesions which are around other people until the rash is healed so that it doesn't infect the other person. Keep the skin dry and covered and avoid touching items in shared spaces, and disinfect shared spaces frequently. Salt water rinses as oral rinses to avoid sores. Warm baths, particularly adding baking soda and Epsom salts, can help. And over-the-counter medication with paracetamol and ibuprofen can be considered and given. However, the do not pop the blister or scratch the sores. which can slow the healing process and spread the rash to the other parts of the body as well, and it becomes even more infected with secondary infection. Shave the areas with, do not shave the areas with sores until the scabs have healed and you have a new skin covering underneath. So these are some of the important aspects which need to be looked into. Research and advances are being made in terms of antiviral therapy, and a lot of research is ongoing with clinical trials, and of course the vaccination is good. Thank you so much for a patient hearing.